The biggest issue for most residents of the Saanich Peninsula is primary health care, is having a doctor.
When people talk to me about not having a family doctor, it's more what they don't say than what they say. You can hear the fear and panic in their voice.
And sometimes these are the people most in need of a family physician. And it's something we have to do something about.
We've watched with alarm over a number of years as doctors have retired in this community and they're not being replaced.
We've looked into the numbers, and currently there's over 15,000 unattached patients on the Saanich Peninsula.
Their engagement in healthcare is either through walk-in clinics, which we have only a few of, or through our emergency room.
And when you have as many as 15,000 people in a community that are without a family physician, it's unsustainable to look after those people in a walk-in center.
We had a family doctor who retired, and he gave his practice over to somebody else, and unless you got in the first couple of weeks, the new person had no room for anybody else.
Additional problem on the peninsula is that we have a good number of doctors that are soon to be retiring, and they have been unable to successfully attract young doctors to come and take over their solo practices.
Because young doctors coming out of medical school want different things.
The hospital is important, but without physicians for primary health care, there would be no hospital. Most people don't want to end up in hospital. It's not a place they want to be.
As this problem grew worse, the foundation realized that we needed to get involved.
Because I think in today's environment, healthcare is about more than just a hospital.
We're now looking at the health of the community, not just what happens in the box.
Primary care centers are, in my opinion, the solution. If we build the right environment and we create a supportive environment that is team-based care, they will come.
That to me offers a great deal of flexibility and freedom, but also I think a huge benefit to patients. You can cross-cover each other and provide very good continuity of care in both the community and the hospital.
We need that expansion of care as we age and we have more maladies, and that's what this clinic does for us as seniors.
We know the plan of Peninsula Medical, and we're all for it.
You would have nurses and pharmacists and a counselor and a social worker all working under one roof. It'll have huge impacts.
The Saanich Peninsula Primary Healthcare Society has built upon a model that has proven to work. We need to be a partner within that model and ensure that healthcare continues to grow the best possible way that it can on this peninsula.
One of the primary problems we're facing is creating an environment that the young doctors want to be involved in.
Whether it's the space, or the innovation, or the value added, or the planning. Again, primary care has changed.
It's different from the way it was 30 years ago.
My 3 children and I are currently without a family doctor. I have heard that there's a plan to bring some doctors to the peninsula, and I'm very excited about that.
People need to know that not only do they have a family doctor, but they have a place to go when they need to. Key to our future in healthcare is hopefully having doctors in place that take away the need to actually go to a hospital. That would be true success.
Of all the campaigns I've been involved with, in the time I've been involved with the Hospital Foundation, I believe this campaign is the most important and will have the most impact.
I'm going to encourage donors to continue to come forward and make sure that we build a community health care system that is something that we'll all be proud of and something that we'll all have confidence in.
I am determined that every person in this community will have a family doctor.